In this bowl, I have a number of breastfeeding questions, and in this cup, I have my coffee. So let's get to answering your most requested breastfeeding questions. How can I tell if my baby is hungry? One way to tell if they're hungry is if they're starting to lick their lips, move their head tight side to side, and if their fists are closed. If they are crying, that is a late sign of hunger, but you can read them before and understand when they're getting hungry. And you don't even have to get to a crying baby. It's really great. How do I know if my baby is getting enough breast milk? This is a great question because a lot of us, when we're breastfeeding, we feel so confused about that because we can't see, right? With a bottle, you can measure it. You can see exactly how much this baby is drinking. But with breastfeeding, we're having to just kind of feel it out. But there are signs that you can know for sure your baby is getting enough milk. Number one, their weight is changing. They're gaining weight. They're getting more plump. Number two, their lips are wet. They're not dry. They're not kind of cracked or looking dehydrated. Three, their diapers. Their pee is a light colored yellow. It's heavy. Their poos are consistent. If they start to have any dark urine or very light pees and they're really not peeing very much, or their skin is getting kind of, you can do like a pinch test where you grab the skin and pinch it, and if it holds its shape, that's a later stage of sign of dehydration. So we want to get to them before that. But looking at their lips as well, looking at their eyes, and a baby, if they're getting enough milk, you'll feel it in your breast as well. Your breast won't feel so full after a feed. When they're done breastfeeding, they'll be noticeably softer. So these are all basic signs that your baby is withdrawing enough milk to help them grow and stay healthy. How can I prevent or relieve sore nipples while breastfeeding? So with preventing, you want to get a great latch, right? You want to find a position that's comfortable for you and is helping your baby achieve a deeper latch. I do have a video on this that's step by step, how to get your baby and your body in a position to help them latch. The big cues are getting their chin pressing against your breast tissue, compressing your breast into a C shape so that you kind of like flatten it out a little bit, and then getting them to take in not just the nipple but the areola as well. And everybody's areola is different size, so the baby doesn't have to consume all of it. Sometimes that's a lot, but you just don't want them hanging on and eating just from the nipple because that's when it starts to cause pain. If you are finding persistent nipple pain when you're breastfeeding and you have tried so many different latches, you have tried so many different positions, we should check for oral ties. If your baby has a tongue tie or a lip tie that's affecting their ability to move with their tongue, and if you're hearing clicking noises, if they keep pouring milk out the side of their mouth while they're eating, if they're constantly like losing suction and then grabbing back on and kind of like holding with their gums and not their tongue, these are all signs that they're using their tongue inadequately for feeding, and that there are things you can do to help them breastfeed more comfortably. But this is one way to prevent nipple pain. As far as relieving sore nipples, airing them out, putting some breast milk on them, air them out. Lanolin has also been very helpful. But just letting your breast kind of like hang out and get some fresh air on them. This can be one way of doing that. How do I know if my baby has a good latch? If your baby, there's a textbook answer, right? There's like a way that their mouth should look. As a mother who has breastfed premature infants whose mouth did not look like the picture, there is another definition that I like to give as to how do I know if my baby has a good latch? It doesn't hurt you. They're able to withdraw milk comfortably and they're gaining weight. It's like, for me, those are my things. Like, is the baby taking milk out of my breast? Does it cause me pain? Is it comfortable for them? Then it's a good latch. It doesn't have to look like the picture in the textbook, and it doesn't have to be like exactly this angle and this much lip. And if the mummy's comfortable, the baby is comfortable, and milk is getting removed, it's a good latch. How do I thaw frozen breast milk? You can thaw it at room temperature. Just take it out of the fridge, let it thaw by itself. If you need to thaw it faster, you can heat up some water and let it sit in the hot water. But if you're gonna do that, you need to make sure it's mixed. You kind of shake it up, because what can happen is hot pockets. The hot water can start to heat up certain parts of the milk, and then when your baby is drinking, they get like scalded. So we wanna check and make sure the temperature is even. We've shaken up the bottle, and never microwave your frozen breast milk. Don't microwave it. How can I increase my breast milk supply? I have another video on this one. But breastfeeding, unless you have certain medical conditions, which we'll get into with a whole different video, that you clinically have low milk supply. A lot of mummies experience low milk supply because they have damaged nipples, so they're not withdrawing milk because it's painful, or they're not feeding their baby frequently enough, or we're shortening the feeding times to stick to a schedule too much. Breastfeeding is a supply and demand relationship. So when you remove milk from your body, you are telling your body, I need you to keep making this. I need you to keep this up. Make more. But when we stop removing the milk, or when we only remove a little bit of the milk, we're telling our body, hey, I don't need so much. You're full. You can feel, I'm not taking this milk out. You don't have to make so much. So the surefire way, unless you have certain medical conditions, which we will cover in a different thing, is remove the milk. Remove your milk through pumping, through breastfeeding, through hand expression, whichever way is comfortable for you. Remove it every 2.5 hours to 3 hours, especially in the first few weeks. We want to be really consistent and thorough in our removal of breast milk. Another thing is staying hydrated and well nourished. Your milk is going to be wonderful. It's going to be packed with nutrients, but it's going to take it from you. So the more healthy we are, the quicker we can see the results of our efforts of removing milk. Breast milk production, it takes work. There is great marketing, there is great storytelling of these magic pills and these magic solutions that you just have to take one and your milk will quadruple. But a lot of this is false advertising. They are selling you a product. The way, truly, unless you have certain medical conditions, to boost your milk supply and to see it increase and to see it consistently increase is to remove it from your body. Get the milk out. Can I breastfeed while pregnant? So, there are certain circumstances where doctors will recommend that mothers do not breastfeed while they're pregnant, such as if they have gone into preterm labor before, or they have a really high risk pregnancy, or they have a chance of having a premature baby. They might recommend that you don't breastfeed, but for the most part, it is absolutely fine to be breastfeeding while pregnant, but you will notice some changes in your milk. Your breast milk is going to revert back to colostrum, which might frustrate the baby who is nursing because it's going to come out slower. It's going to be packed with nutrients. Colostrum is incredible, but you won't have the quantity and the volume of breast milk that you normally would have. You also might notice your nipples are a bit more sensitive when you're pregnant, and it might hurt to breastfeed while pregnant. You might feel interested again once the baby is born, and you can breastfeed both babies at the same time if that is comfortable for you. Can I breastfeed if I have cold or flu? This is cool. So, one of the coolest things that I learned about when I was in school studying to become a lactation consultant is something called the enteromammary pathway, which means if I am sick, or if I've come across somebody who's sick, my body will create antibodies to help my baby fight off this infection. So not only is it excellent for my baby to get my milk when I'm sick, it also will pick up through their saliva when they're breastfeeding if they're about to get sick, or if they've come across anybody else who has gotten sick. Your body has these receptors that's picking up on different pathogens that might be in each of us, and the milk changes immediately. It's customized medicine for your baby. That's what your breast milk is. So if you have the cold or the flu, it is actually a wonderful idea to give your baby that breast milk. and to keep feeding your baby. It is hard to do though, because I remember being so sick and the last thing I wanted to do was breastfeed. Can I combine breast milk from different pumping sessions? If they are at the same temperature, yes. So if you pump earlier in the day and you put it in the fridge and then you pump again, put that one in the fridge when they reach the same temperature, you can combine them. How do I wean my baby from breastfeeding? There are so many methods of weaning, and one of my favorites and one that I really recommend to mummies, because a lot of the times weaning is kind of treated like you're ripping the band-aid off, right? And it's a stressful situation and it's a guilt-ridden situation, and it doesn't have to be this way. So I have another video that I made that really goes into weaning, but I do want you to know that there are so many methods for how to wean your baby from breastfeeding, and it can be a sweet time with even more bonding, with even more activities that you're doing together. And what is recommended, right? Because there's different situations. Sometimes you have to wean for a medical reason, and you have to wean immediately. There's one method for that. Then there's the other method, which is I am ready to be finished and I would like to wean my baby. And that one tends to be a little bit slower, where you're slowly cutting down on breastfeeding time and then slowly cutting out certain breastfeeding sessions and replacing it with a different activity to make sure your baby still feels secure, that you are there, that they're not just gonna get your attention when you're breastfeeding, but you will slow down and do things with your baby. How do I store breast milk? There is a number of ways. I'll put actually up this slide, because it depends on how you're storing it. In the freezer, you can store it for up to 6 months, sometimes to a year, depending on the type of freezer you have. But please store it in the back of the freezer, not in the doors that open, because that section of the freezer, it's variable in its temperature. And if we store our milk in the back of the freezer, it preserves it for longer. You can also store it in the fridge for up to 4 days. You can store it at room temperature for up to a couple hours. So there's a bunch of different methods, but if you're gonna use the bags, lay them flat, and that way you can stack them up a little bit easier and you can store more milk. How long should each breastfeeding session last? This is great because there is this method, I don't know why people are telling mummies this, of 10-10, right? Breastfeed 10 minutes on the side, 10 minutes on the side. This is absolute garbage. This is, one, going to lower your milk supply. Two, it's gonna most likely give your baby gas, because then they get lactose overload. So how do we wanna breastfeed a baby that, one, keeps their gut balanced, reduces the chances of gas and colic and pain, reduces reflux, and keeps your breast milk supply at a growing level or at a stable level? You treat one breast as the meal and one breast as the dessert. Don't look at the clock when you're breastfeeding. Allow your baby to start on one breast and eat most of the time from that one breast. And then towards the end, when you see them relaxing, they're starting to lose a little bit of interest in your feed, then you can swap over and have the next breast as dessert. But at the next feed, I now start on this breast, right? And this is the meal, and then that's the dessert. And then you're constantly swapping them. It's hard to keep track of, especially like if you're gonna use a haka, which I love, to help remove the pressure from the breast that is the dessert breast for that feed. So one way to do that is to have a clip, and you just put the clip on the side of the bra that you treated as the meal, this previous feed. So then you know, okay, next feed I need to treat this one as the meal. How do I get my baby to latch properly? So this is that same video I was talking about where we go through step-by-step process, but the big keys: chin to the breast tissue, so that opens up their mouth a little bit wider. Compress your breast with a C-shaped hold, which means you're going like this and you're pressing down. And then bring them so that their tummy is to you. Their head, neck, spine is in a straight line. This is all gonna set you guys up for success in your latch. If it is painful, you don't have to grit your teeth and go through with it. You can pop your pinky in the corner of their mouth, wrap it around the nipple and remove so that you can protect and take care of yourself as well. Can I breastfeed if I have flat or inverted nipples? Yes, you can. Of course you can. There is a method called reverse pressure softening, which is a way to soften your breast tissue and get your nipples to kind of pop out a little bit more so that you have a better chance of latching comfortably. Finding different positions as well to help the baby latch onto more of the areola, because a lot of times we will get kind of flat nipples when you're engorged as well. But some mummies have inverted nipples that can evert through breastfeeding, or we just do certain massages before we latch the baby to give us a better chance of a comfortable breastfeeding experience. How do I deal with engorged breasts? So engorged breasts, they mean that your breast milk, your breasts are so full of milk, they need to get relief. Heat is going to soften the breast to help get the milk out more effectively. So applying heat, applying some massage, and then get that milk out as quick as you can. Either through pumping, hand expression, go in the shower, breastfeed, whatever method that you can, get the milk out, because engorged breast can quickly become mastitis, which is very painful, and that can develop into abscess or more sickness and inflammation that we want to stay away from. So the minute you start to feel that toughness, that fullness, that discomfort, apply warmth, get massaging, and get the milk out. Can I breastfeed if I have mastitis? Yes, you actually should be removing milk if you have mastitis. Sometimes it's uncomfortable, but yes, it is safe to breastfeed when you have mastitis. How do I use a breast pump? This needs a whole video on itself to like, how do you set it up? How do you use it? But the big points I'm going to tell you is you don't have to pump for more than 30 minutes. So pumping an hour is not gonna boost your milk supply. Take breaks. Also figuring out the right amount, the right size flange so that your nipples are protected. One sign of nipple damage from a pump is if you notice any splitting or cracking or redness or pain where the nipple attaches to the areola in that space right there. You might have too small or too large of a flange. So I'll do a whole other video on how to use a breast pump because I feel like I have to show you. How often should I breastfeed my newborn? Babies should be eating every 2.5 to 3 hours when they are a newborn. And especially those first few weeks, their stomach is growing rapidly and their needs are growing rapidly, and your breast milk is very easily digestible. So they do need to eat frequently, about every 2.5 to 3 hours. Can I breastfeed after having breast augmentation surgery? 4 primary incision sites for breast augmentation: the inframammary, transaxillary, subareolar, and then the umbilical cord area. So if you have had the type of incision where they cut around the areola, a lot of moms do find that they have more difficulty breastfeeding because of the scar tissue and the effects of nerve damage at that incision site. But mummies who have had the umbilical cord one, especially if you had the incision underneath, which is inframammary incision site, that tends to be pretty common, and you can breastfeed when you've had breast augmentation surgery. So just keeping in mind that if they did cut around the areola, you might face some difficulties. Can I breastfeed with nipple piercings? Yes, you can. You need to take the nipple piercings out because it's a choking hazard, but you might notice that your milk will also come out of the holes that the nipple piercing went through, but it's completely safe to breastfeed with a nipple piercing. Just take the jewelry out. How can I soothe my baby's gas? I have a video on this one too. There are a number of methods. So one big thing is just figuring out what's causing the gas. Sometimes it's dairy that we are consuming as mummies. Sometimes it's the amount of milk our baby's getting. Sometimes it's lactose overload, which is the type of milk that they're getting. Sometimes if they're getting formula, they have a lactose sensitivity. Sometimes it's positioning. There are so many ways to help soothe the baby's gas. Big ones is certain positions, feeding upright, especially bottle feeding upright, slow pace, breastfeeding in an upright position, keeping your baby upright for at least like 10-20 minutes after a feed, tummy massage before feeding, not after a feed. There's so many reasons why babies get gas. So the big thing is figuring out the cause of it, but there are comfort measures that we can do for sure. Skin to skin is a huge one, and just keeping your baby against you, especially baby wearing, that is one way to help them with gas. But I really love infant massage. I love infant massage. And I think it has just been so beneficial to my family and to the mummies that I've worked with. So looking into certain types of like, I love you massages, and where we're moving with the movement of the gut and helping the gas get out. I need to pump. I had a mummy reach out to me who said, you know, like, my breastfeeding is going really well. My baby's gaining weight. I'm comfortable. My supply is good. Should I be pumping? No, you don't have to be pumping unless you want to be pumping, unless you want to build up a store of milk in case something happens and you're separated from your baby, or you're planning to go back to work, or you're planning to go away for a little bit. So pumping is a great tool, but you don't have to pump. And our last question is, how do I breastfeed a premature baby? Man, this is a good one, because I had 3 premature babies, and my babies all had energy levels that were really low birth weight. They didn't have these buccal pads, which are like these fat pads in their cheeks that help them maintain strong suction. They didn't have the energy to breastfeed. So my daughter didn't have the energy to breastfeed or bottle feed. She couldn't withdraw milk herself. She had so little energy. And we couldn't maintain her sugar levels as well, her blood sugar levels. And so we really had to problem solve and try to figure out, how do I feed a baby who can't pull milk out? But I want to teach her how, and I want her to exercise to build up this strength in her body, but I also need her to get to gaining weight. So there are so many methods of how to feed a premature baby, especially when they're unable to breastfeed and bottle feed. But one thing that we found, there's so many, right? There's cup feeding, there's spoon feeding, there's syringe feeding, there's tube feeding. And what was really important to me was I wanted to teach her how to suck, how to use her tongue, and how to withdraw milk so that I could have an easier time transitioning her to my breast. We did a lot of measuring when we got her home, and I measured with cup feeding and realized she was taking almost none of it. It looked like I was finishing the cup, but she actually wasn't getting any milk from it. Syringe, same kind of thing. She would spit a lot of it out. She couldn't swallow it. She couldn't really maintain it. And one thing that we found was really beneficial for her was a feeding tube taped to our fingers, to our pinky fingers, and using a syringe at the other end. And then slowly, as she would suck, slowly pushing a little bit of milk out at a time. It took us it was pretty much a full-time job feeding her. And I was really grateful I had my parents to help me and my partner to help me when he was home. But yeah, it literally took, because she was a very slow eater, each of our feeds would take about an hour. And already you're feeding a baby at least 12 times a day. So that's 12 hours out of the day that we're feeding. And I had 2 other children. So having that help was so amazing that each of us could get involved in the feeding process for her. But yeah, a tube on the pinky with a syringe, slowly pushing it through to reward her efforts of trying to suck, so that when she could eventually gain enough fat and enough energy, she could breastfeed. But it took 8 weeks. She couldn't breastfeed for 8 weeks. So I had to be really vigilant about pumping and keeping my milk supply up and getting this milk supply and getting my milk out and feeding her this way. And another method, if your baby can latch onto you, which is awesome, is putting the feeding tube and attaching it to your nipple. So they latch onto your nipple, and then you help just push through a little bit more breast milk while they're trying to nurse. But this is what worked for us. There are so many ways to feed a premature baby, and some parents don't have any struggles with feeding their babies. They just need to wake them up because they tend to have lower energy levels, to eat more frequently, and check their weight and make sure that they are gaining well. Sometimes you can just breastfeed your premature baby. So every baby's different, every situation is different. For the babies who struggle with breastfeeding, bottle feeding, that's what worked for me. If you like this kind of video, if we should do more question and responses, will you like it and subscribe and put in the comments any other question you want me to answer? I want to give as much information to you as possible. I hope this helped. Love ya. See ya, pizza. My coffee's cold. I took like one sip this whole time.